Today we're going to talk about the Community Health Needs Assessment in Maine. The first thing to note about the Maine Community Health Needs Assessment is that it's a shared community collaboration between the biggest hospitals in Maine. These hospitals include Central Maine Healthcare, Maine Center for Disease Control and Prevention, Maine General Health, Maine Health, and Northern Light Health. In 2012, several hospitals in Maine began collaborating on shared data. By 2015, the biggest hospitals in the state had combined efforts to share records, resulting in a combined community health needs assessment rather than individual reports. This is the fourth collaboration between the hospitals. Maine's mission with this shared report is to engage and activate communities to address issues with community health and to use data-driven records for health improvements. They hope that by combining their needs assessment into one collective report, that Maine will become the healthiest state in the United States. Before we get into the community health needs assessment, it's important to understand the demographics and other factors driving this data. To start off with Figure 1, the age distribution in Maine as of 2019 shows that the predominant age groups were 50 to 54, 55 to 59, and 60 to 64, a slightly aging population which we'll talk about in later slides. Table 2 shows the ethnic and racial groups in Maine which were predominantly white at 94%. Non-Hispanics make up 98.3% of the population at just over 1.3 million individuals. It's also important to look at the top leading causes of death in Maine, as these factors help drive the community needs assessment data and the recommendations that the state put in place to decrease these deaths. According to the 2022 report, the top 5 causes of death include cancer, heart disease, unintentional injury, chronic lower respiratory disease, and stroke. The state report was done on 7/5/2022 and includes 8 areas of concern, including mental health, social determinants of health, access to care, substance and alcohol use, older adult health, diabetes, oral health, and cancer. Priority 1 focuses on mental health. According to the state report, mental health includes emotional, psychological, and social well-being. It affects how we think, feel, and act. It also determines how we handle stress, relate to others, and make healthy choices. This area of the report had several different concerns, starting with the workforce. According to the report, there are not enough providers in the state of Maine to meet current mental health needs, leading to more crises and higher ER utilization. According to the report, 32.1% of high school students and 24.8% of middle school students reported feeling sad or hopeless for 2 or more weeks in a row, while 16.4% of high school students and 19.8% of middle school students seriously considered suicide. Additionally, inadequate services such as lack of culturally competent care, care integration across co-occurring disorders, and poor quality services led to additional problems. The last concern was medication. Respondents reported lack of access to care and also medication prices remain high and unaffordable, especially for uninsured and underinsured patients. The second area of concern was social determinants of health. According to the report, social determinants of health are the conditions in which people live, learn, work, play, worship, and age. Domains include education, economic stability, healthcare access, environment, and social connectedness. Examples include access to healthy food, housing, water, and relationships. Areas of concern on this report consisted of barriers to care, mainly lack of access to care and cost that prevented people from being able to get the necessary care. Housing and transportation were another concern, with respondents reporting that they didn't have any access to transportation and also lack of access to safe, affordable housing. Another area of concern was cultural competency, with respondents reporting that diverse population, ages, language, and literacy levels all contributed to cultural competency concerns. This area also included things like youth services, In particular, the lack of youth services available for the Maine population, which prevented this population from obtaining care. They also indicated coordination and community cohesion concerns, specifically a lack of coordination between facilities. And lastly, funding was also a concern, um, with respondents reporting that a lack of funding and available resources led to greater disparities among different populations, specifically minority groups. The third priority was access to care, with a report saying access to care means having the timely use of health services to achieve the best possible health outcomes. It consists of four main components: availability of insurance coverage, availability of services, timeliness of access, and the healthcare workforce. There were several different areas of concern, with the first being Maine Care enrollment. According to Maine Care, 57.3% of Black or African American individuals were enrolled in Maine Care, which was twice the level of their white counterparts. Respondents reported finding a provider who accepts Maine Care is difficult, making it challenging to obtain preventive screenings and ongoing medical monitoring for chronic conditions. Respondents also reported difficulty with the forms, specifically those with low literacy or low English proficiency struggled to complete the Maine Care applications. The cost of care was also a concern, with 24.7% of Blacks or African American respondents reporting that there was a time during the last 12 months that they needed to see a doctor but could not because of the cost. Another concern is the uninsured population. 12.8% of African Americans, 8.8% of whites, and 15.5% of other races do not have access to health care in Maine. The fourth area of concern was substance and alcohol use, with the report saying alcohol and other drugs can cause significant impairments, including health problems, disability, and failure to meet major responsibilities at work, school, or home. Substance and alcohol use has been linked to co-occurring mental health disorders such as anxiety, depression, and attention deficit hyperactivity disorder. There were several areas of concern in this population, specifically lack of treatment options, with respondents saying that lack of treatment options, including harm reduction and access to naloxone, were areas where they were not able to obtain substance use or alcohol use treatment. Many respondents also reported stigma, feeling as though many others judged them for their alcohol and substance use disorders. Additionally, coordination and community cohesion was another area of concern. In particular, lack of support, lack of recovery homes, and the ease of access with obtaining care were all concerns. Youth services were also a concern, with many reporting need for more screenings, interventions, and referrals for treatment options, specifically towards youth and their families. Funding was also another area of concern, and a lack of funding was available for patients to access substance and alcohol use services, especially those who were uninsured and underserved. Health equity was the last concern, with respondents reporting differences in quality of care among different ethnic groups, high poverty rates, and lack of housing support led to poor outcomes in certain individuals, specifically minority groups. Another individual concern was older adults. According to data, approximately 1 in 3 people in the United States between 65 and 74 had hearing loss, and nearly half of those older than 75 had difficulty hearing. Hearing trouble made it hard to understand and follow a doctor's advice. Some of the areas of concern included participants expressing concern for the number of older adults who may have cognitive decline with undetected and untreated hearing loss due to their cognitive delays. Deaf patients were also a concern, with lack of long-term care or nursing homes available with residents who could sign. Advanced directives were a third concern, with a lack of advanced directives made for deaf patients in particular, which made it hard for providers to meet end-of-life care needs. Additionally, lack of caregiver support left many feeling as though they were struggling to care for an aging family member. Transportation was also a concern for these older age groups. Those living in rural areas in particular left many individuals feeling alone and isolated and unable to go to doctor's appointments. And lastly, a workforce shortage of healthcare providers limited the care that older adults could receive. The sixth area of concern was diabetes. The report says diabetes affects how your body turns food into energy. Diabetics are unable to efficiently process the sugars in the food that they eat. This can lead to long-term health care problems such as heart disease, vision loss, and kidney disease. If left untreated, diabetes can be fatal and is the seventh leading cause of death in the United States. There were several areas of concern within the report, specifically lack of physical activity. The report notes 20.9% to 24.7% of adults reported a lack of leisure time physical activity in Maine. Additionally, respondents reported that a lack of access to or cost of healthy foods was a barrier to eating well and managing diabetes. Respondents also reported not receiving enough SNAP benefits to meet their needs. Respondents also reported affordable gyms and outdoor activities as a concern, with the cost of gyms being too high and difficulty going outside, especially in those colder months. The seventh area of concern was oral health. Oral health refers to the health of the teeth, gums, and the entire oral facial system that allows us to smile, speak, and chew. Oral conditions are frequently considered separate from other chronic conditions, but these are interrelated. Poor oral health is associated with other chronic conditions such as diabetes and heart disease. There were several areas of concern, including cost. For those with insurance, there were high copays and other out-of-pocket costs. For those without insurance, they weren't able to pay for the cost of treatment. And across all groups, there was a concern with taking time off in order to see the dentist. There are also environmental inequities. In certain areas, lack of fluoridated water to prevent tooth decay was observed. There's also many concerns about unhealthy foods, specifically foods and drinks that are high in sugar content, which could increase the likely risk of tooth decay. Lastly, transportation was a concern for many respondents, with many respondents reporting not having a dental clinic nearby. Lack of available transportation increased the barriers to receiving effective and efficient oral care. And lastly, cancer. Cancer was tied for fourth place among with heart disease as a priority health concern with 30% of responses. It should be noted that cancer and heart disease are the two top causes of death in Maine. There were several areas of concern with cancer diagnoses, the first being available providers. Many respondents report that a lack of providers or those who take their insurance as a reason they did not get the preventative screenings necessary. Many also missed appointments or follow-up visits that would have screened for the preventative cancers. Proximity of services was also a concern, with respondents reporting transportation as a barrier to care, as their doctor's offices were too far away for patients to travel due to lack of transportation. And finally, vaccinations. There are many unvaccinated individuals or those with vaccine hesitancy, which increased preventable types of cancer like cervical cancer. Additionally, unhealthy habits like smoking led to the likelihood of getting things like lung cancer. Tobacco use in public was also an issue, with respondents reporting high tobacco use in public in Maine areas. In conclusion, the top issues contributing to health disparities in Maine included affordability of care, lack of insurance, lack of providers or clinics, lack of transportation, stigma, judgment, lack of community support systems or resources, other health disparities. On a low level, there's many things that we can do as a community to help improve these areas. One thing, such as mobile clinics, can address behavioral health, mental health, substance use, medical and dental concerns for those in underserved communities and rural areas. Schools and other facilities can offer behavioral health screenings, medical screenings for kids to help address areas of concern with youth services. And as a community, we can provide our community members with things like healthy farmers markets, upgraded SNAP benefits, and food pantries to help with those health disparities and those specific social determinants of health. Thank you so much for watching the presentation on the Maine Community Health Needs Assessment.